So today we are going to be talking about one of the labor induction medications called PITOCIN. And I am going to be creating a series about the different labor induction medications or agents that are used to induce labor. So if you are not already following the community, do not forget to go ahead and follow and subscribe. We would love to have you. Let's go ahead and get straight into the video. We're going to be starting with a couple different sections. The first section, we're going to talk about what is PITOCIN. And we're starting off with PITOCIN because it is a very publicized drug. Some people love it, some people hate it, but it doesn't have the best reputation. So I'm going to be explaining to you guys what PITOCIN is, what PITOCIN is used for, who should be placed on PITOCIN, what are some of the requirements that should be looked at prior to being put on PITOCIN, and the pros and cons of PITOCIN. We are going to weigh the risk versus benefit. So let's go ahead and get straight into it. Starting with number one, what is PITOCIN? So PITOCIN is a drug that is used to induce labor. It is used to cause frequent contractions and also strong contractions. We release our own natural oxytocin as women. However, sometimes if our own natural oxytocin is not enough, then that is when artificial PITOCIN comes into play. And it is used to create strong and frequent contractions. PITOCIN can also be used to help aid in reducing bleeding or stopping bleeding after delivery. So those are the two main things that PITOCIN is used for. Now that you guys understand what PITOCIN is for, let's move on to who should be placed on PITOCIN. So number one, if you are going to be a labor induction, then most likely you will have some type of PITOCIN that is administered during your induction, unless you are the lucky few who don't need PITOCIN at all. However, prior to being placed on PITOCIN, you should receive prostaglandins. And prostaglandins are used to help thin the cervix so that the cervix can be optimal for PITOCIN. And that brings me to my next point. The person being placed on PITOCIN should have a Bishop score of 8. And we are going to talk about just what a Bishop score is in the next point, so stick around. The next person who should be placed on PITOCIN is a person who cannot receive any prostaglandins. And that is a person who may have already ruptured and they can't receive any of the prostaglandins such as misoprostol, Cervidil, or they can't get a cervical ripening balloon because their membranes have ruptured. The next person who may be placed on PITOCIN is someone who has had a C-section prior. So someone who is technically being a VBAC, which is a vaginal delivery after cesarean. If you are going to be a VBAC, it is contraindicated to give you what we call prostaglandins, Cervidil and misoprostol. So the only thing at your disposal if you are a VBAC and you are being induced is a cervical ripening balloon, which is what we call a manual dilator. Some people say that it has thinning properties, but it really focuses on manually dilating the cervix. And also PITOCIN. These are the people who may be placed on PITOCIN either if they come into the hospital in labor or if they are being induced for whatever reason. So now that we know who may be placed on PITOCIN, we are going to talk about what a Bishop score is, because one of the things that we discussed in the prior point is in order to be placed on PITOCIN, you should have a favorable cervix that is going to be ready to receive PITOCIN. So one of those things that indicates if your cervix is favorable, if your body is favorable for induction and also PITOCIN, is something called a Bishop score. A Bishop score is a tool that is used to measure basically if you are ready to be induced, okay? And there's 5 different components that are involved in a Bishop score. Number 1 is going to be your cervical dilation. How dilated are you? And you can go from 0 to 10 centimeters dilated. Number 2 is going to be your effacement. And effacement just equals thinning. How thin is your cervix? And this is measured in a percentage, and it can go from 0 to 100%. The next thing is going to be station. Where is the baby within the pelvis? The pelvis is 0 station. Anything above the pelvis is what we call negative, and it goes -1, -2, -3. -3 is the highest, or what we call liable, which means the baby is not engaged in the pelvis. Anything below 0 is positive, and we go +1, +2, +3. That just means how low the baby is within the pelvis, and the lower the better, especially when you start pushing, and that we will talk about in another video. So definitely make sure you are subscribed. You don't want to miss that one. The next thing is cervical consistency. Is the cervix soft? Is the cervix firm? How does the cervix feel? That is very important. And the last one is cervical position. We talked about how to get your cervix in the best position and also how to get the baby in the best position in the prior video. So if you have not checked that out, I will link that at the top and also in the description so that you can understand how to get your baby in the best position. So this is what a Bishop score is composed of. And usually anything 5 or less is a low score. Anything 8 or greater is a great score. And usually if you have a score of 8, your cervix is ready for Pitocin. Your cervix is also showing that it is ready for induction. So you want to make sure you ask about that Bishop score before being placed on Pitocin. Now we are going to get into the last segment of this video, which is what are the pros of Pitocin? What are the cons of Pitocin? So we are going to weigh the risk versus benefit of Pitocin. Starting out with the risk of Pitocin. So the first risk of Pitocin is if you are on Pitocin for a prolonged period of time, your receptors may become what we call saturated, and they may not respond as effectively as they could while you're on Pitocin, which may just in turn prolong you being on Pitocin for even longer, because it's like the receptors of Pitocin in your body are missing each other. They're not really responding. And this normally happens when the body and the baby are not really ready to go into labor. I see this a lot with inductions, especially post-date inductions. So knowing that Bishop score is really going to help you combat this. The next thing, and this one is a very important thing that you want to pay attention to, is fetal intolerance to Pitocin. Well, we talked about at the beginning that Pitocin helps to create 2 things. Number 1, strong contractions, and number 2, frequent contractions. Sometimes if babies do not have enough reserve, maybe you're having a small baby, or maybe you're a post-date induction and the placental perfusion is not as great, we see that sometimes in those cases, the baby doesn't respond well to Pitocin. And sometimes it doesn't even have to be a small baby or a post-date induction. It can be for a number of reasons. But when those contractions come and they are strong and frequent, sometimes some babies do not like it and they do not respond well to Pitocin, and that is what we call fetal intolerance to Pitocin. And if that is to happen, we try to use different things to help you go into labor. Another thing that can happen while being on Pitocin is something that we call tachysystole. And tachysystole just means overstimulation of the uterus. Some people have very sensitive receptors to Pitocin, and you may see them contracting when they're not even on that much Pitocin. That just means that the Pitocin needs to be either turned down or turned off to allow the uterus to rest because when you do have tachysystole, sometimes that can cause the baby not to tolerate the contractions because they're happening too often, too frequently, and that is not something that we want. But that is a risk of being on Pitocin. Another thing that can happen while being on Pitocin for a prolonged period of time is it can increase your risk of bleeding. We talked about those receptors in the beginning. If you are on Pitocin for a prolonged period of time, then those receptors kind of just stop responding to the Pitocin because they're saturated, they're used to it, they know what it does. And like we talked about before, Pitocin is something that is used after delivery to help aid in reducing your risk of bleeding or reducing the amount that you bleed. So if those receptors are saturated and they're not responding to it, then that can lead to what we call a hemorrhage, which is a lot of bleeding after delivery. It is a risk that happens with being on Pitocin for a prolonged period of time. So if you have not seen my video of how to go into labor naturally, definitely go ahead and check that out. It will really help you to know how to release your own oxytocin so that you don't have to deal with a lot of these different risk factors. And the last risk that I want to discuss when it comes to Pitocin is that there is a risk of a C-section. Anytime that there's a risk of a fetal intolerance to something, there's always a risk to C-section, because if the baby isn't tolerating a medication and the baby's heart rate is not coming up in a time span in which is appropriate, then that is automatically going to be an emergency, and an emergency C-section takes place, because at the end of the day, the main priority is a healthy baby and a healthy mom. So there is a risk of C-section just due to the risk of fetal intolerance to oxytocin, just due to the risk of fetal intolerance while being on Pitocin. That automatically gives it a risk for C-section, because I always joke around, but it is the truth. The babies dictate labor. So definitely want to mention that so you guys can have all of the facts when being placed on Pitocin. Now moving on to the pros of Pitocin, the benefits of Pitocin. I always say that Pitocin can be an amazing drug if used appropriately and when the body is ready, okay? Pitocin has helped countless mamas be able to deliver vaginally when their bodies haven't released enough Pitocin. Just like Pitocin can have the risk of you having a C-section, it can also decrease that risk if the body is ready to receive it and help you aid in a vaginal delivery. Another thing that Pitocin can do is, if we talked about hemorrhaging, right? It has the risk of you hemorrhaging, but it can also decrease the risk of you hemorrhaging if the receptors are not saturated, if you haven't been on Pitocin for a prolonged period of time. And the last benefit of Pitocin is if your water is to break. We talked about some of the people who may be placed on Pitocin. If your water is to break, it may be the only medication that you can get to really help you aid in a vaginal delivery. And because of that, it can help decrease your risk of infection, because sometimes the body is not ready to go into labor when the water breaks. And so Pitocin is usually started in those cases, and it helps mamas to have a vaginal delivery. So Pitocin can be a great medication, like I said, if used cautiously and when the body is ready. That is why it's so important to pay attention to your Bishop score. If you have found value from this video, do not forget to like this video so that it can go out to more mamas so that they can also be educated about Pitocin. Do not forget to follow the channel and join the community. We would love to have you here. I am going to be uploading so many more videos that is going to help you and educate you so that you can make empowered decisions for you and your baby. Until next time, I will see you guys in my next video. Bye.